pandemic disease. So again, the United States is not prepared. We're not prepared. People know that I believe the great pandemic is coming. It's not COVID. I call that the lesser pandemic. The great pandemic is coming. It's going to be a bird flu pandemic. It's going to be rough. We're going to see some significant mortality around the world, including.
This is Dr. Redfield, former CDC director. Clip 2. Wicked man.
We're going to see some significant mortality around the world, including the United States. It's not going to distinguish between different people who's going to have a bad outcome. Like COVID had a bad outcome for those of us that are over 60, 70, 80. The bird flu, when it comes, it's going to have a bad outcome from children, for adolescents, for people in their 20s and their 30s, 40s, 50s. It's going to be problematic. The good news is we have the mRNA technology, so we'll be able to make a vaccine pretty quickly. The bad news is we'll never be able to make enough vaccine for 350 million people quick enough because we haven't built the redundancy in being able to convert that science to products for the American public. And the bad news is we still haven't built the redundancy for diagnostics.
Enough. And the U.S., America, is collaborating with the panda nation scientists to make bird flu strains more infectious and deadly as part of a $1 million project. Think about that, friends. Biologists are trying to make bird flu easier to spread. Think about that. To spark the next global pandemic, wicked men. They want to exterminate a large percentage of the human race. They're working in the laboratories.
This virus came. Tony's right that prior to gain-of-function research, the only way new pathogens came in to the human species was spillover. But now, in the presence of gain-of-function research, where you can take a pathogen into a laboratory and change it,
people. Yeah. So while I have you, can I just ask, and again, I'm sort of thinking about how does this look if we potentially face another pandemic, which I know, again, everyone in this system is constantly preparing for. We're seeing a lot of concerning reports about bird flu at the moment, the outbreaks in cows leading to tests in milk. I'm getting questions from my friends who are also moms. Is this safe? Is it not? What is the level of concern right now about that potentially becoming a pandemic?
Well, thank you, Casey, because this is why I'm really concerned, because we're making the same mistakes today that we made with COVID.
Okay.
And what do I mean by that? We're not testing to really see how many people have been exposed and got asymptomatically infected. We should be testing every cow weekly. We should be testing every cow weekly. We should be testing every cow weekly. You can do pooled PCR. We have the technology. The great thing about America is we're incredibly innovative, and we have the ability to have these breakthroughs. We could be pool testing every dairy worker. We could be pool testing every dairy worker. We could be pool testing every dairy worker. I do believe that there's undetected cases in humans because we're once again only tracking people with symptoms. When we did that with COVID, the virus spread throughout the Northeast undetected because it took a long time to get to the vulnerable individuals. But in the meantime, thousands, hundreds of thousands of people were infected with asymptomatic or mild disease and never came to medical attention. We have to switch from symptoms to actually definitive laboratory testing. We have the capacity to do that today, like that.
All right, well, that's cheerful.
The latest CDC tracking data on bird flu suggests the virus may be spreading undetected among humans.
Now, I will tell you that COVID was a minor pandemic. People say it's the biggest pandemic we had in 100 years. It's a minor pandemic. It had probably less than 0.5% mortality, and then only in certain patient populations, those over 60, over 65.
Wait, 30 seconds. Why should we be worried about bird flu?
Bird flu is going to be a major pandemic. If in the cases to date in humans have about 50% mortality. If you look at bird flu right now, it's in over 150 million of our chickens and birds. We now know it's in 48 different mammal species. It's now gotten into humans. It's starting to change in humans. Once it learns how to go human to human, we will have a catastrophic pandemic.
We also learned this weekend that the number of hospitalizations is up to 4. That doesn't seem like much, and it isn't. But the worry is if the virus is left unchecked, a more substantial health crisis could be looming.